Is he coming in next week then?
I don't know yet. I don't know the depth of his problem with the hospital. I just know that he was lined out all week, so we'll see what he's gonna do based on that.
Wait, was he only the medical director for a certain part, not Riverbend? I wasn't clear about that.
He was not a medical director for Riverbend. He was just an ER doc at Riverbend. He was
Okay.
medical director for EMS agencies.
Got it.
He is now the medical supervisor for the
Got it.
ER.
Okay.
In addition,
Is that like for the nurses?
that would be for everybody, including the physicians that are working there too.
The other
He's in
doctors?
charge of the ER. He is the head doctor for the ER now.
Wow.
Is this something he did not intend to,
I'm.
or this quickly, or it sounds like?
I don't know that he politically was like vying for it, but at the same time, he wasn't trying to stay away from it either.
And then off to you.
Okay, questions on ICP stuff? Because we're gonna make a vast change in moments here. Okay, on your piece of paper,
Uh-oh. My piece of paper's full, both sides.
there are 5 major effects. I would like to know what the effects are, and then I would like, as much as possible, mechanistically, for you to tell me why we have those effects. There are 5 effects of inflammation. There are 5 effects that inflammation leads to, and I would like to know what those 5 effects are, and I would like to know why they happen, as mechanistically as you can get.
Back, jeez.
Those are your 5 major effects of inflammation. You just have to talk about why.
Edema, redness, warmth, pain, loss of function.
Okay.
Why?
The erythrocytes are going to the area, causing the edema because it's like an increase of the blood flow to the area, which is also causing redness with the erythrocytes. And it's warm because there's more blood cells in that area, and pain is causing the loss of function.
How? Why? How's that happening?
I don't know, something about like the lymphatic, it's like. the
Vascular
lymphatic response or-
permeability is being increased by the allowing more fluid to enter the interstitial space.
Say that again, Chad.
Vascular permeability is increasing because nitrous oxide releases from the
Nitrous?
Nitric.
nitric oxide, and that's allowing more fluid to enter the interstitial space.
Where's that being released from?
From the endothelials? No.
Our arterial cells.
Endothelial cells?
Give me a more specific idea of where that's being released from.
We talked about this with
Just be more specific.
I'm just thinking
So I know
too.
what you're talking about.
these drugs.
I don't know what it is. There we go.
I was right.
So you were not, you were on.
Okay?
I was like, what is that? There we go.
How is that happening?
Histamine release?
Histamines are causing nitric oxide to be released?
Histamines cause, yes?
Histamines cause.
Yes.
Say it again, Chad?
Is it from the tearing of the cells themselves?
I don't know. Is it?
Oh, that's right.
Well, what does nitric oxide do?
Vasodilation.
Vasodilation, okay, vasodilation, excellent, okay.
Or vascular permeability, doesn't it increase the space between the endothelial cells?
Does it?
Baglione says yes.
How does it do that? If you're saying yes, it does. What is nitric oxide?
It's
What kind of a chemical? It's a what?
It's a gas.
It's a gas. What does it act on?
Some complicated receptor.
It's not complicated at all. Where does it act?
Cell membrane,
What cells?
or,
How does it cause vasodilation if it's acting
on the
vasodilation?
arterioles, on the vessels.
That's not specific enough.
Excellent.
The vessels
Arterial,
include endothelium. What's it work on? What does nitric oxide work on?
Smooth muscle?
Muscle?
Smooth muscles.
really.
I think you said it a while back.
At some point in my life.
That works on smooth muscle. So how does it, you were just trying to make the argument, Mark and Amanda, you're trying to make the argument that it increases intracellular clots?
Yeah,
Which are between what kind of cells?
endothelial cells.
So how does it do that?
I can see Brian Nichols' whole immunology
And
discussion.
the things
Because
like
I recorded
float
it and I
through-
watched it
through
multiple
all the
times,
holes.
but now it's just a
All
blur.
the holes.
Yeah, it like spreads apart and there's holes and Brian Nichols gets like really in depth and you're like, oh.
And then you space out. And
Here it
you
is coming back to hunch.
Yeah.
Probability of an arterial wall.
So I guess we need to not confuse chemicals. What else is happening? What's that? Histamine release.
yes.
From where?
H1 receptor.
Boom.
H1 receptors release histamine?
That to know.
Okay, so my question was, where is it coming from?
I don't remember.
From what?
Degranulated mast cells.
Okay, so this is gonna come from mast cells. And where else? Say that again, who said that? Which ones?
Basophils.
Yes,
Oh, nice done, Andrew.
Bam.
good tag team
Doctor,
there.
Mr. H, talking to
So those are the places that histamines are released. Yay, we're getting somewhere. What do histamines do?
Increased vascular permeability.
By doing what? How does that happen?
No idea.
No, you have to have an idea. What is vascular permeability?
It's the, there are increased junctions, larger size junctions between the cells of the vessel wall,
Okay, what cells?
the endothelial cells.
Great, so what's it gonna do? You have your information now.
It is going to increase the space between endothelial cells and the vascular.
Yes, this is what Mark was trying to argue nitric oxide did, because he couldn't remember Brian Nichols' talk on histamines.
Well, it was
But now you
all related. It was like a huge talk on immunology.
So,
Everything blurs together.
Stand and hold your arms out.
Feel invited.
We're going to hold hands or arms or something. So we are two separate endothelial cells, yes?
Yes.
We are two separate here, but yet we are packed in tightly so that nothing can get through us.
Correct.
When a histamine interacts with an endothelial cell, it scrunches that cell up in itself. And it creates a gap between us. So it increases the intracellular clefts that are made by not letting us scrunch so closely together.
By squeezing the cell.
And therefore fluid can leak out, and fluid leaking out is what we refer to as
Interstitial fluid.
Basal permeability.
Edema.
permeability.
Permeability.
Permeability. So we have vascular permeability. So, vascular permeability via causing those endothelial cells to create more intracellular clefts between them. Great. What else does it do? Amanda,
Does it act on H1 receptors?
to do what?
To release nitric oxide indirectly?
So it has some effects on helping endothelial cells go through the nitric oxide pathway. There are other chemicals that do that more. It does something else though.
Release
It actively does something.
Mucus production.
Well, it does. It does actually increase mucus
By mast cells.
in some of our areas. That is true. It's not what I'm
Not in the left
saying
forearm, no.
here. In the inflammatory process, mucus production
let it
really
go
is,
long enough.
is not part of the inflammatory process, but it's part of the immune process, of which inflammatory process is part of the immune process, so. But we're not into the immune system yet, we're just in inflammation right now. What else does it do? Histamines.
Along the line, it releases interleukin-1, which is a pyrogenic.
Boom.
Causing
Damn.
heat.
There are some signaling that does that.
You get itchy.
Yes. Histamines increase vascular permeability and this other major thing that it does. They do
It makes
these
it
two big,
itchy.
giant, major things. That's one of them. This other thing is the other major thing that it does. That histamines do. Guys, go back to EMT for a minute. And in EMT land, where is the #1 place that you hear about histamines in EMT? In anaphylaxis. How does anaphylaxis kill you? Don't say anything about the respiratory system.
Vasodilation.
Yeah.
So what do histamines do?
Vasodilate.
Good job.
Hence the edema. And
They also vasodilate. So you're getting a couple of different vasodilatory effects. There's even more than that, but we're getting a lot of vasodilation here, right? Okay, so with vasodilation occurring on both of these items, and with that increase in vascular permeability that's happening right here, we get edema. So what did you say? Give me your phrase that you and I were arguing about a moment ago.
The initial one or the?
The initial one. You said,
Edema causes inflammation.
that's what you said. Use the same three words, but put them in the correct order.
Inflammation causes edema.
Yes, that is correct.
Okay.
Inflammatory process, this is the inflammatory process, the start of the inflammatory process, which will lead to edema. Good? Why are we red?
There's more blood flow to the area.
There's more blood flow to the area, and what is coming with that blood flow?
Erythrocytes.
And what are erythrocytes in terms of this
White blood cell.
topic?
red.
They're red.
Yeah, they're red. Yes. And why are we warm?
Because there's increased blood flow. Hot blood
There's
flow.
pyrogenics.
Because of the pyrogenic effects of something.
Good. So we're warm because blood, with its pyrogenic effects that we're talking about right now, with its metabolism of ATP, is slightly warmer than most of the rest of our body. And so when you bring blood flow to an area, you bring with it the warmth that it is carrying. Yes?
Same reason why.
And all of those are related to a word that Cody used. What word did you use?
Chin and stump.
You used it.
What was that?
You actually contributed. You contributed.
I can, oh, it sounds so bright.
You used a word at the very beginning,
Um,
and I ignored you because it wasn't specific enough. But now it is.
I don't remember.
It had hyper in it.
Sure that was me.
I think a couple people said it, but it did come from you at one point. Yes. With that?
No, I said something totally.
Say it.
Hyperlipidemia, is that what you said?
Say it.
I said hyperresonance out of
Oh,
joking.
no, close. Hyperlipidemia.
I
What
don't
does that
know.
have to do with?
I don't know. I just throwing out
What
another
does
hyper.
hyperlipidemia have to do with?
Nothing.
No, what does the word mean?
Lipids, fats,
So therefore,
edema,
Would be-
hyperlipidemia, what is that?
increased fats.
Fats in
In
the,
the,
And the In the
Emia,
blood?
Blood.
yes, so, is
No,
that, okay, good.
no. I just thrown it out.
Hyperemia, which is just increased blood flow. Hyperemia means, so emia, the suffix emia means a blood condition. Hyper means what? Yeah, excessive. So you have an excessive blood condition. That means you're having increased blood flow to that area. That increased blood flow is being caused because of histamine and nitric oxide release. And we haven't talked about bradykinin yet. We have bradykinin release as well. So bradykinin, nitric oxide, and histamine release to the chemical mediators that are happening in that area are leading to hyperemia. Hyperemia is then causing the edema, redness, and warmth. Good? Remember in your was it AMP2? Was immunology AMP2?
Mm-hmm.
And you talked about somebody, them, whoever them were that you took your class from should have talked about complement proteins. Yes? Complement 3A, specifically in this case, but you don't need to know that. Complement proteins are the chemical mediators that are going to help to lead towards this. Complement proteins and bradykinin are released from damaged tissue, along with things like interleukins and tumor necrotic factors that are released from monocytes and damaged cells, right? That lead to the inflammatory process.
Right.
I'm not killing you with that portion of it just yet. We'll come back to that sometime. But now we're here. So now we're at pain. What causes pain?
The swelling.
Who said that? Yes. Caused by what? What leads to that?
The
What do you
pressure.
mean what leads to that?
Well, what is
Your
act-
receptors are stimulated and you experience pain.
And what's stimulating them?
The pressure in the area with the swelling and stuff.
Pressure stimulates nociceptors?
That's a no.
I didn't say it's a
That's kinda
no.
what I was. I would say yeah. I feel like it should.
In the right circumstances, right?
Feeling that, that's pressure.
Sure, what? This is all response.
In the thing.
Yeah, but like you have your, there's a light that shines and they have a little receptor or a little thing on their surface.
On the white blood cells? Yeah, the white blood cells do have little things on their surface. Are those related to pain? Okay, so when it comes to the pain, we need to use, as I said, Mark gave it away, so we use Mark's term
Ouch.
on his ouches. We have bradykinin again. Bradykinin is in the plasma. It's released in the plasma from damaged cells. Bradykinin is one of the things that's going to lead to the release of the histamines from the mast cells and the release of nitric oxide from the endothelial cells, along with some other chemical mediators there too, complement A, 3A, and some other chemical mediators that we have not thrown out there yet. Bradykinin will be in the plasma and it directly plugs into pain receptors to make you feel pain. Good. And then from the cell standpoint, endothelial cells will release prostaglandins. I think it's E2, glandins.
You can read that? I thought you wrote that way because you didn't know how to spell it and you just
I
kind
write
of.
this way because I always write this way. Have you not seen my writing?
I have, and I just always
And yours
assumed
were
that it was out that way so you didn't have to worry about spelling it.
Is that better?
No.
Prostaglandins, specifically I think it's prostaglandin E2 that will come from the cell and also plug into pain receptors to make you feel pain. And then, Noah said it, I think. There's
That's a
also,
lot of things.
yeah, the edema. leads to increases in local tissue pressure, which will affect those receptors directly, will cause a conformational change in those receptors directly. And that pressure change will, that deforming of those pain receptors also causes them to signal. You realize that pain is a perception, right? So we increase the signaling of those receptors and the brain perceives pain. Edema is leading to local tissue pressure, increases in local tissue pressure, which is going to deform those pain receptors and make them signal as well. So we have bradykinin, we have prostaglandins, and we have that local tissue pressure, all activating pain receptors so that your body perceives pain. Good? So that's where our pain is coming from. And what's our loss of function?
From the swelling?
Yeah, so when we start having specifically the edema and the pain, right, the redness and the warmth really don't do a whole lot for our function. But when we have the edema and the pain, the edema and the pain tend to make us not be able to use and function with that body part, right? Because of a reminder that it hurts and the edema that can lock it into place. Make sense? So in the context of inflammation, which is part of the immune response, it is obviously not the immune response. It is part of an immune response. But it is the part of the immune response that we call inflammation, with damaged tissue that leads to this. And our 5 major effects. We good so far? So this will be kind of the initiation of our immune response. This is happening simultaneous to other factors that are trying to get our white blood cells to marginalize and diapedese. Remember those words? So we're trying to get the white blood cells in the right place. So from a grander picture of the immune system, we need to have the inflammatory response, because why? What's the purpose of the inflammatory response?
Bring white blood cells into the tissue area.
Yeah, for starters, to bring white blood cells and natural killer cells to that area so that they can start to fight whatever the infection is, and
To bring blood to the area.
to bring blood to the area,
To bring nutrients.
to bring nutrients there, to
Clotting
increase
factors.
nutrients. What's that?
Clotting factors, if there's an injury.
Okay, so talk to me about one more thing related to this inflammatory response. And what Dustin just said.
Clotting factors.
Are we bringing clotting factors there? Are we trying to clot in an inflammatory response? What are we trying to do?
Fight an infection and make repairs.
So what's our goal with inflammation?
Increase blood flow.
To what?
Increased blood flow.
To increase blood flow where?
To the
That's the
affected
site of
area.
injury.
Area
And be more specific, not just the affected area, but where in the affected area?
Where the damage is.
Yes, to the damaged area. I want you to be specific with talking about body locations.
To the muscle tissues.
Yeah, to the cells, which are where in relation to blood vessels?
Inside.
Right there.
No, say it.
Right there next to them?
Right there next to them, which means they're not where? Where are cells not?
In the blood.
In the blood, which means we have to have the blood do what in order to get to the cells?
Deliver.
It has to be permeable to get to the cells.
Yeah, it has to get permeated. It has to leave the blood vessels. What would clotting do?
Stop it from leaving.
It would tend to stop that from happening, right? The goal would be to stop clotting or to stop flow of blood leaving those areas. But we're trying to enhance that. So we can actually go one step further. And what else?
It also creates new blood vessels. Well, like grows. them.
Okay, so down the road, it'll create angiogenesis. But what else related to what we're talking about here?
Vasodilation forms the gaps in the endothelium to allow rolling marginalization, and I can grab onto all of those white blood cells. and push them
Yes.
forward.
From a larger immunological standpoint, true. But what's gonna prevent platelets from coming into contact with the collagen? Y'all remember that platelets coming into contact with collagen will cause the cascading effect that leads to a platelet plug? What's gonna prevent that?
The thing
Is
that
it
breaks
really
it down.
chemical.
collagen or collagen? You confuse me
Isn't
every
it
time.
potato potato?
The way you say it confuses me.
Why?
Is it collagen or collagen?
Sure.
No, which one is it? But it is the same thing. We
Yeah.
are talking about the same
Same thing.
thing. Okay, I didn't know if there were two separate
Because
things.
then I suppose if you're from Canada or.
I just wanted to verify that it wasn't two separate substances.
Sure.
Okay, all right.
Our northern neighbor had Italian musculoskeletal and
Okay.
capillaries.
Okay, back to where we were.
Which
What
is
were
related to
what-
anti-clotting.
platelets and makes them slippery and not connect?
Anybody?
What's the
I remember
question?
the chat with Nichols where on one side it's trying to clot it and the other side it's breaking it down, but I don't remember the details.
This is wait,
So that's in
five,
that's in the clotting cascade. We're pre-clotting cascade.
Fibrinolytics?
We're to the
That's
point where we
more-
don't even want the platelets to aggregate.
So
Is this where
then
you're
it's
talking
gonna
about
be that
fibrin?
backside that is released.
Fibrin.
fibrin.
and fibrinolytics.
So that's, okay, we're
Clotting.
not given a drug,
Clotting.
which is the fibrinolytic, and we're not into fibrin because we're not into the clotting cascade because we're not allowing platelets to aggregate to begin with. What's gonna prevent the platelets from sticking together? So the clotting cascade, y'all understand?
Aspirin.
The clotting cascade within a platelet occurs when a platelet makes contact with another platelet. We're preventing that. What would prevent that?
Aspirin.
Well, aspirin would. Does the body release aspirin?
Nope.
So what does it release? Nitric oxide is a vasodilator. It's our most powerful vasodilator in the body, but it has nothing to do with platelets. Well, it doesn't have nothing to do with platelets, but it doesn't cause platelets from
Unsort
not
of
coming in
terms.
contact.
I was gonna say angiotensin, but that's another clotting one.
Let's go back to mast cells for a minute.
Mucus.
What do mast cells release histamine, but they also release something else. Do you remember what they release? This chemical, the purpose of this chemical in normal daily life is to counter the histamine charge within a mast cell so the histamines are inactive within the mast cell. But once they're released, it has a different effect on your body.
No.
And this release is, it's a fast release so that it can act very quickly, but this chemical also is reuptake very quickly back into basophils and back into mast cells. We can talk about mast cells and basophils as one for the most part. They are not the same cell. For a long time, they're actually thought to be the same cell. They are not, but they have very, very similar function. So this chemical is also released from mast cells and basophils. It's released, it acts very, very quickly, and then it gets reuptake very quickly so that the effects go away also downstream. So this effect is only at the site of this inflammation. Mons is like,
I like. I'm
Mons
just
is
so
like-
pissed. I remember learning this for like weeks. And like,
what kind of a drug, what kind of a chemical do you know it has to be?
Something that gets broken down fast.
What kind of chemical do you know it has to be? Dustin already gave one. What kind of chemical does it have to be?
Platelet, anti,
It has to be an antiplatelet. You already know one because you just named it, which is what?
aspirin.
Aspirin. But we know the body doesn't release aspirin. What other antiplatelet related things do you know in your repertoire of things you know? Sure, it could be Plavix. Do we have Plavix in our body?
No.
No? What else could it be? Name something else.
Whatever hemophiliacs have too much of.
Hemophiliacs are missing a clotting cascade factor.
Um,
So that's how they do it. They get into the cascade, but they can't complete the cascade.
okay.
Anybody? Anybody? I'll give you a hint. I'll give you the first
Still
letter.
walking away. There's enough.
Histamine? I'm just guessing here.
Yes, you can buy a vowel. Which vowel do you want?
I don't know.
Give it a hang
You gotta buy
yet?
a vowel. You have to do
Hey,
Oh.
hey.
Hey, yeah.
oh,
I.
Oh, you.
oh.
Me, the only one we missed.
Chemo. Heparin.
Heparin.
Ah! Yes, I won! I won!
Heparin. Our body contains heparin.
Really?
The mast cells and basophils use heparin to sequester the histamine, to make the histamine stay put until it's released.
Sorry.
Now, once it's released, the mast cells and basophils release histamine and heparin. The histamine has the effects that we have here. What effect does the heparin have?
Prevents clotting.
Makes the platelet slippery.
Anti-platelet
Aggregation.
aggravation.
Prevents platelet aggregation, that's right.
Prevents platelet
So
aggregation.
the heparin's gonna prevent the platelet aggregation at that site so that we can absolutely make sure that that vascular permeability happens. Because as soon as we start moving the endothelial cells and they start scrunching together, as those endothelial cells do it in places that are not capillaries, where we have arterioles that are still there and they have the muscle around it, they have the collagen that's on it, the connective tissue. When that connective tissue is displayed to a platelet and the platelet makes contact with that collagen, it starts the cascading process. It starts the aggregation, the platelet plug, and the cascade. So we're trying to prevent that in the short term because notice that when we talked about inflammation, I didn't say damaged blood vessels leading to bleeding. That's different. We're talking about tissue damage, not blood vessel damage. We want the platelets to aggregate during blood vessel damage, right? To prevent blood loss. We don't want it to stop vascular permeability that's going to allow the healing agents from our immune system to get to that site. Does that make sense? Yes.
So if you were like slightly allergic to bees and you got stung by a bee on your arm and then you also cut yourself right there, would you just like continue to bleed?
So you have a problem, right? If you're allergic to bees, then you have the histamine response. If you cut yourself, you're still going to have the inflammatory response that's happening locally in addition to the systemic responses of the bee sting. And if you're anaphylactic to the bee sting, I wouldn't be worrying about the cut.
Well, let's say the bee sting wasn't systemic enough. Like say some people just swell up like a lot. Like say it was that kind of.
Yes. You'll have both effects because those are local effects. Then it's just a balancing of which local effects are having a higher effect than other local effects.
So you would bleed more.
Not necessarily, because you also have smooth muscle contractibility that's going to cause some issues. So
I guess I got stuck on the sprained ankle and inflammation
about it.
and there being an immune response versus a broken blood vessel, broken tendon.
You might have that. But if you have damaged your tendon, for example, what's the inflammatory response going to bring besides just white blood cells? What has to happen to that site?
It has to heal. It has to
That's right, yeah.
increase blood flow to heal the.
Which means you have to have stem cells and other, right? And you have to have the neovascularization, the angiogenesis has to happen there. You have to have the epithelialization where you're going to build new tissue in that area, right? All of that comes from that immune response. Because the immune system isn't just to fight pathogens, it's also to bring healing agents to that site to clean out that area.
Yeah.
Not to mention the fact that when you damage that area, right? Guys, y'all understand this number, right? Y'all understand that number?
Yes.
Good. These are, roughly speaking, how many body cells you have. You know what that is?
An even bigger number.
An even bigger number. That's how many bacteria you have in your body right now. You're more bacteria than you are you.
That's number though, it's not size though, aren't we?
Those
Like-
bacteria make me
That's a
neat.
number.
Yeah, but like, our cells are bigger than the bacteria cells though, right?
What's your point? The
We're more
point is
powerful.
that you have this damaged tissue. And not only are you having to bring healing agents there, but you have opportunistic bacteria as well
Yeah.
that will try to get a hold. So your immune system takes care of those opportunistic bacteria and other pathogens that might be there, in addition to bringing healing agents. That's the point of the immune system, not just to destroy chickenpox. It's actually there for all the little things too, like the thumbtack you got, or the, jammed finger that you got, or the rolled ankle that you have, or the knife through your chest cavity that you got. It doesn't matter what it is, it's there for all of us there.
Yeah.
It's fine-tuned based on the chemical releases that you have and what's used versus not. Good? Questions on that? Okay, so things to review. You better reflex if you're not remembering that, because this is now like the third time that we've kind of gone over it, so clearly I find an importance in it. So you should too. 2 is the inflammatory response is the start of immunology, and those two things collectively will lead into some of the things that we're going to talk about in neurology. So with neurology, which is the rest of this week, we're going to talk about stroke, but we'll also talk about diabetes. Diabetes is both an endocrine problem and a neurologic problem. We cover it in the neurologic problem issues because of the hypoglycemia effect, but it's truly an endocrine problem more than anything else. But that has a lot of inflammatory mediators and immune responses that are coming with it. So that'll also be the talk that we lead into the immunologist. Good?
Is there a mention of this week or next week?
Next week. Excellent.